I'm Nishanta Bordoloi, strength and conditioning coach at the National Cricket Academy. Going back a little bit about history of myself, being a former professional cricketer and then moving on to becoming a strength and conditioning coach for the last about 15 or 16 years. What we decided once we got into the NCA and their old protocols about cricket, I'm sure everyone understands the demands of the game, especially being a contralateral sport. A lot of overhead activities as well, and also a lot of demands on unilateral strength and imbalances, asymmetries, what my friends have spoken about in the morning. Right, so whole thing, our thought process was about designing a protocol coming out of the usual and trying to understand that how can we design a protocol which will help us to one factor of about preventing injuries in cricket. With a room full of physios, it's one of, I think the backbones and a team integrated together with the SNC, what we create to develop a good, formidable structure for our players to maintain their strength and conditioning and maintain their physical abilities to be able to perform at the highest level for a longer duration of time. And the one thing which most of the time, which I feel, again, going back to my background, is that people don't miss too many games because of their performance or because of some other reasons. Most of the time they're out of the game for a longer duration because of injuries. And if we can design something of a protocol which can help to assess the players in a way where we can start then addressing the issues specifically to the need, I think we will be able to have a fitter set of players for our state and also for the country. Right, as we move on, if we look at it, there's been a tremendous change over the game over the years. We've understood that from a format which used to be just about 4 Ranji Trophy games in a year and only a few under-19 games, and the players used to practice throughout the year for that, which has obviously changed over the years. Right, it's the demand of the game has changed. It's become more fast-paced, more number of games, less rest periods, small transitional periods in between, obviously increasing the toll on the body. Right, so for that, now do we need to still keep doing what we used to do, or do we, because there has been a transition, do we also need to think about what we are doing? If we look at the epidemiology of injuries, our history which comes out, tested off 12,000 plus players. Most of the injuries have come amongst what has been recorded in fast bowlers, apart from the acute injuries, which is of course ball impact and all of that stuff, but of course it has been based on biomechanics of fast bowling and of course workload management. Do we look at workload management as one perspective, or do we look at performance training as the other side of it? So there are always two sides of the spectrum. What we're trying to do is we always think about what we should have not done, and also on the other side, can we think of what we can do? Right? Again, the whole objective of this moves on to what we're trying to come up as we move along in our testing protocols. What are the percentage of injuries, as I spoke about it, about what happens on an acute stage? All right, the most common modern day injury surfacing hamstring strain, most severe on lumbar stress fracture in young fast bowlers, and then bowling 41%. If I go back, bowling is on 40, wicket keeping 28%, account of most injuries. Acute injuries, most common 64%, chronic 16%, and then chronic ones again going to between 8 and 22%. Right? So that's why we need to look at things that, what can we do to avoid these issues, which starts on an acute level, especially on the movement pattern, which leads on to becoming a chronic issue. What are the questions that we have most of the time in our mind about injuries in cricket? All the movement screening is one of the things which everyone has been doing over the years, and has it, as we spoke about in the just in the few lectures before, and what we all know about, has it helped to stop injuries? Maybe to some extent yes, maybe to some extent no, because the same injuries keep coming back again and again. So do we need to then figure out what do we do to prevent these injuries? Can we do something different? Can we think out of the box? Are we addressing the issues, right, prior or post? Now, as we spoke about the MSK screening, which is going to come on next, which of course was a lead up to the first lecture, what I am here about, is about what are we doing. Most of the physios in the state, they are doing the IPS, injury prevention screening, right? is that what we're doing prior, and is that what we used to do? So are we addressing things? Can we actually foresee something, and can we actually, try and stop it, or not probably stop it, but address it before it happens? Or do we actually wait for something to happen and then try and address it? Right? What are the measures? Can we identify actually? Yes, I think there's, to some extent we can have some data, but to a lot of extent individual differences will come into play, and hence we need to make sure that we are addressing every issue individually. All right? So that is one thing that we're looking at. If we don't address things individually, then we are going in a holistic approach, then obviously every individual is different, and every demand, every player has a different role in the game of cricket. Right? It could be a batter who might be an attacking batsman, it could be a batter who would be a defensive player. A batter who might take 60 balls to score the 100, a batter who might take 200 balls to score 100. And also it the demands of the game is also based on the situation of the game. Right? Demands of the game is based on how the match is poised. Demands of the game depends on the pitch, depends on also the bowler who's bowling at you. So the game is not just what you think is going to go on one way, it's also a lot of other factors revolving around the game of cricket. Right? Again, if we go with the epidemiology of injuries, we see that 18% of injuries happen to fast bowlers. With the latest research which was done by Archer et al. 2022. Right? So if we see that, then obviously we again understand of what the injury prevalence has been just brought before, about what my friends have presented just before about the lumbar stress injuries, which is one of the most prevalent in fast bowlers in cricket. What are the demand analysis of the game? Right? If we look at the demands of the front foot, the trail leg, if you look at the glenohumeral joint, the scapulothoracic joint, the positioning, the role of the pelvis, the front foot landing, the back foot landing, obviously with a lot of demands. Again, I know that the lecture was supposed to be before with Mr. Nitin Patel addressing this, but I'll just touch base on this a little bit. If you understand the demands of the front foot and the back foot, right? The front foot landing obviously has a lot of demands from the glutes on the left leg if you're a right-hand fast bowler, whereas there'll be a lot of internal rotation happening on the right leg, right? Which automatically puts in a lot of pressure in the parts of the specific areas of the body. So that's why when we see that if those who have been doing the IPS, you would see that an indifference between the internal rotation of the hip between the left and the right. Right? I'm sure quite a few of here who I can see who's probably been doing it on a day-to-day basis. You will obviously see that because obviously the right adductor being obviously more, I'm talking specifically here right-hand fast bowler. Right? And obviously the glute on the left side will be more tighter. Right? What happens to the leading side, the shoulder of the front arm with the stability and the pull? Then you get the thoracic lumbar spine, which is again optimal transfer of force. We're talking counter rotation, lateral flexion. Right? I'm just touching a little bit on the technical point of that bowling analysis of lateral flexion and counter rotation, which happens obviously, which causes a lot of, again, in the chain of muscles through that time. Right? Does it make sense? Right? So and then you have the hip, and there's repetitive hip internal rotation, and then of course the ankle and the foot having a supination and bracing, right, on the front foot. If we move on, movement lines to the fast bowler, if you look at this, it's all been touched again. What I said about the right-hand fast bowler, about the left hip, the right hip on the first video over there, so you can obviously see the areas of concern that we're focusing on. Again, the demand analysis of the batter, again, pretty much similar to a bowler between the front foot and the back foot. Again, the front foot being the leading leg, right? A lot of stress, especially if you're playing. And most number of times, if you see, there probably wouldn't be a number to it, but I would say that there's a lot of more demand on the front foot being more active, because a lot of shots are being played on the front, especially when spinners are bowling. I feel that there's a lot more number of times that you would play front foot defense or a front foot shot than actually you would play a back foot shot, if you look at it on a day's game, on a multi-day format. Right? Similarly, again, restricted left thoracic rotation, tight hip external rotators, right, hip flexors, right knee, the tight knee, internal rotator popliteus getting tight because of the demands of the movement pattern you're going throughout in the game, repeating the movements for a number of times. Again, just basically giving you the whole objective of, again, what was being presented with the hip internal external rotators. Obviously, when Nitin Patel comes back on with his presentation, he will address all of this, because I don't want to touch base on what is going to come up for you guys. We'll give you a better understanding. But again, if you understand the muscles which get tight, obviously the hip flexor, right, which is greatly involved when you're playing, if you're doing a repetitive front foot defensive all the time, the hip flexor is most likely to get tight, which is again cause and hamstring tightness on the same leg. We move on now, addressing as I move on towards the testing protocols that I'm going to come on. We're talking about tensegrity. So, right, if like, it's a very pretty example, I wanted to put up these cricket nets just to make it, when we go for a batting set, we see the strings coming from all sides and trying to balance the pole in the middle, giving it stability for the nets to stand up. So pretty similar to what we would like to address when I'm going forward to my presentation on the performance testing that we have come together. Again, what we're looking at, spiral stability. So if we don't have the spiral stability, imbalances will be caused. And if there's moment the imbalances causes when things start getting a little haywire. What percentage of that? That is a question that we need to keep gathering more data to understand what it is about, right? So obviously, if there is the stability of the muscles between an imbalance and asymmetries being caused between right and left, obviously there is going to be a certain amount of disparity being caused, which could result in some injuries coming forward. Right? That is why, again, as I said in the morning, the physio and SNC go hand in hand, where you guys are doing the IPS every morning to make sure those imbalances are cut short straight away, attended to right there. Right? Joint stacking is our spine being held in space. Again, when we talk about lumbar stress fractures and lumbar reactions, obviously the most important thing is about how we are maintaining our midline stability. If our midline stability is not mentioned or it's not in line, then obviously there are more chances of imbalances being caused and obviously resulting in more stress in certain areas and resulting in injury. Can we identify injuries even before they happen? Big question, right? I think I wish someone could, and then obviously that could have been a lot of things made easy, but obviously not. There are sometimes we can and sometimes we don't. So our whole objective is to keep looking for measures where we can try and protect our players as much as we can, or for any individual for that matter. Right? Based on that, we've come up with a few assessments. Obviously, we've got about 6 assessments that we look at, which is very quick, and we don't want to waste a lot of time while we do these assessments. What are those things that we can do? Based on our scores of about 250 athletes, this were then, among the camps that we have throughout the country over the last years, and we tested this on about 250 athletes between the age group of 17 and 23 years, which obviously is now we're getting more and more data coming in, with obviously being tested with a lot of senior players as well and everyone, and then it is giving us very good numbers to look at and to collect more data on it. The number test, we're looking at overhead squat, the walking lunges, the half kneeling medicine ball throw, the adductor hold, the single leg glute hold, and the medial calf raise hold. Right, I will go through this test one by one just to give you an understanding of why those who don't come from the cricket background or those who have probably not done this, I would like to go just touch base upon all of this for you guys to understand why we're doing this while I talk through this protocols. Right, the overhead squat, I think pretty much a universal test that we do. I think everyone would know about the overhead squat. It gives us a very, very quick understanding of the movement patterns of an athlete. Right, it gives us the range of movements around the joint, the mobility range, the ankle range of movement, the hip range of movement, the thoracic range of movement, and the shoulder range of movement. Right, it gives us very good idea of where the athletes, and we also start understanding a little bit about muscular imbalances as well, like if there's a lot of valgus happening on the knee, or if there's tightness on the chest or the upper traps because they're not being able to lift their hand up all the way up. So it just depends on what we're looking at. There are a lot of perspectives. We can also look at, if you look from the back side, you can also see lateral shifts happening. Why is that lateral shift happening? When we talk about muscle imbalances, we can quickly again go back to the physio and say, you know what, I've observed this. Is there a patterning on this? Which gives us an idea to understand the athlete better, for enable us to again start designing programs or to address those issues straight away. Moving on, we have the walking lunge. Again, one which I feel is a very, very prominent test that, and a very active way of doing getting an understanding of the movement of the active movement of the player. And again, as my friend Anand had mentioned, cricket being a unilateral sport and of course having contralateral demands, you understand the asymmetry, especially when you're doing the walking lunge. Right? It gives us unilateral imbalances, again, lateral shifts, right? Also the control movement when you're doing, acceleration and deceleration, we understand the decelerative movement of the athlete, plus the knowledge of moving unilaterally, right? Again, as you see, the game demands a lot of front foot, back foot contact happening, a lot of front foot defense, front foot landing, back foot landing, right? Imbalances created. Is there valgus in the knee again happening and unilaterally? Is there also a lateral shift happening? Right? Is there a core control when you're doing the movement? Is there lateral flexion happening? So all of those factors again gives us a very good understanding of the imbalances created within the movement or within the athlete. The next one that is a very power dominated test that we wanted to design to understand the anterior sling system, but when we talk, most of you people must have heard about the hip shoulder separation. It's a very, very common theory going on now, hip shoulder separation, which is a very essential demand of the game. Right? So if we need to understand the anterior sling system, right? If we don't understand this, so we need to understand, is there an imbalance? It is pretty obvious that we would have an imbalance between right and left, but what is the difference? So that's the number we're trying to gather, right? Just to give you a demo of the, so we're trying to cut out everything, all the other lower part, lower extremity, and we're just trying to understand what is the force that you can develop in the anterior sling, because a lot of our throwing, bowling, everything is demanded on the rotational component of the game or the body. That was one of the reasons why we again moved into understanding the medicine ball rotational throw. Moving on, then we started understanding the difference between our glute strength. Now if we saw, when I went back, if we go back to our to the few previous slides, that about the front foot landing and the back foot, with the one glute being more active and the one adductor being more active. So we wanted to understand what's the difference of numbers that we get between the right and left. So the single leg glute hold, we tried just an isometric hold test where we try to get the number of seconds or the time hold of that test, and what's the difference between the right and left. And then we start to understand, is there an imbalance between the right glute and the left glute. The next one, adductor hold. We've again spoken about the right glute, the right adductor, and the left glute, or the vice versa with the left hand bowlers. So this is again one we try to understand the contralateral strength of the obliques on one side and the adductor on the other. So a pretty simple test is the adductor hold, why we try to make sure that the malleolus is rested on the bench and we have our elbow on the floor. We try to look at the same so that you maintain a straight line between the ankle and the shoulder. So then we try to again measure the time, or keep the time for the hold, and try and understand the difference between the right and the left. And the last one is the 45-degree rotational single leg calf hold. This is to understand the strength of your calf endurance and how long can you hold it. Again, an isometric test gives us again a specific muscle that we're trying to address. So all of these, and you hold it. It's an isometric test. The moment you drop, the test ceases, and we record the time, and then we look at the difference between right and left. So what are the findings? Obviously, we've spoken about what are the findings that we get in there. So we look at range of motion in the overhead squat, stability, shifts, midline stability, unilateral, walking lunges, unilateral stability, movement patterns, weight transfers. Medicine ball throw, I've already spoken about. We understand the rotational power of the anterior sling. Single leg glute hold, isometric test, strength between right and left glute, adductor hold, contralateral chain strength, right? We understand the isometrically how far can we hold it, and obviously the single leg calf rows, which is again an isometric endurance test. What are the overall findings? These tests, if I go back through the test and the numbers that we've got over our last camps that we finished, that gives us a very good understanding. There's a clear difference of numbers, right, between the right and left, and it clearly gives us an asymmetries. And if we take out the list of injuries that we've addressed, you would definitely see that this quite equate to what is being given to us in numbers, right? There were a few results which were a little, there were a few outliers as well. This is just an idea about the right and left leg. So obviously it goes as per the test, the overhead squat, the lunge, the medicine ball throw. So if you look at the right-handers, you'll see the orange line. They'll obviously have more strength towards the dominating side, whereas the weaker side. So if you look at the glute hold, you will see that, on the blue number 24, you'll see that, the left glute was stronger, which is 65 as in percentage-wise, and then obviously the right glute was weaker. Right? Again, if you look at the right adductor, the right adductor was stronger compared to the left adductor when we do a adductor hold test. Similar, it was the opposite for the left-handers. The left-hander, it came in as an opposite result. The left adductor was stronger, the right glute was stronger. Right? Again, on the medicine ball throws, they were like stronger throwing to their right side as compared to throwing to their left side. Now, there was quite a bit interesting point is that when we had a right-hand bowler and a left-hand batsman, they were pretty much, in equation, unless there was the only difference what again we observed was again fast bowlers. Again, in fast bowlers, where they were little more dominated to a certain side, especially the bowling side, if they were like a regular fast bowler who only batted a bit on their other side. Right? That is the only, otherwise most of these numbers you'll see is pretty much not as big a difference as the other sides as compared to the previous slides. If I just show you, if you see the numbers here, left-hand batters, and I go to the next one, you'll see there's not much of a difference between the two on the other side. Now, if we look this, as I said, the results did give us a few outliers, right? Again, but those outliers were pretty much understood as why they were, because it probably, they were lack of training history, or probably they did something, and they actually did have a lot of imbalances in them, right? As I said, the beard difference that we found was only about 3 to 4%. So hence, I would like to, say or believe, or we would like to believe that, that the test did actually give us pretty much a positive feedback of what we wanted to achieve, with a difference of 3% on the right-handers and 4% on the left-handers. There was pretty much gives us a very good positive understanding of what we tried to achieve. If I go back, it only leaves for this entire room of us full of people, physios as SNCs, to try and, carry on, do a little bit more research into this and understanding the biomechanics of the game, the demands of the game, correlate that, and then come up with even more bigger data to, come to a conclusion of whether these tests are actually viable and whether they're giving us a feedback, and is it on towards the positive side of the feedback. Right, thank you very much.